Hi, my name is Catherine. I'm a nursing student, and today I'm going to be in charge of changing your CVAD dressing. Now, have you had this procedure done for you before? You have? Alright, perfect. But just for today, I'm just going to verbalize every step as I go as I change your dressing today, okay? Now, before I start, can I ask for your full name and date of birth, please? Okay, Jabel Navarro, July 16, 2003. I'm just going to check your bracelet and make sure everything's correct. Alright, I see on your bracelet that your name and your date of birth match, and I don't see an allergy wristband on you, so I'm just going to double check. Do you have any allergies? Maybe allergies related to chlorhexidine or any sort of adhesive? No? Alright, perfect. And do you have any pain today? No? Alright, so I'm just going to get started and explain the procedure to you. So what this procedure is called a CVAD dressing change. Now what CVAD stands for is your central venous access device, and that is the line that's connected right here on your chest. I'm just here to be changing the dressing on top of it, and what we do usually when we change the dressing, we change it every 7 days. Today's the 7th day, so I'm just going to be here to change it for you. When I remove the old dressing, I assess for any redness, any swelling on your skin, and then I check the line itself for any sort of cracks and leaks. And for the line, I take a look at the measurement and make sure the line has not moved at all from the last procedure. All right. Any other questions? Now I'm done explaining. No? Alright, perfect. So I'm just going to get started. I'm going to get started with 20 seconds of hand hygiene. I'm going to put on some gloves and then I'm going to get my station clean. So 20 seconds. Okay, now that my hands are clean, I'm just going to put on some gloves. And just a reminder, this procedure should be a painless procedure, but please let me know if you feel any pain or discomfort throughout the procedure, all right? All right, so I have my materials here, but I'm just going to remove here so I can clean the surface. So I'm just going to clean the top here for 30 seconds. I'm going to take a clean paper towel. Okay, now that the surface has been cleaned for 30 seconds, I'm going to dispose of this. I'm going to let this air dry for about 2 minutes. But just for the sake of the video, I'm going to pretend that it already has been dried for 2 minutes. So I'm going to move back the kit and my other equipment. Right. So, first thing I'm going to do, I'm going to remove my gloves. I'm going to do 20 seconds of hand hygiene. Then I'm going to start preparing my kit. So for my kit here, I'm just going to try to not touch the sterile field on the box as much as possible. So I'm just going to open that here. I'm going to remove the sterile gloves, remove the sterile mask. Okay, and then for the sword review, I'm going to put that in first. I'm going to try to avoid any edges that I've touched. Right. Okay, should be all in. Dispose of that. I'm going to put the bio patch in next. there we go. I'm going to dispose of this. I'm going to put this sterile mask on. So Mr. Navarro, I'm going to ask you to put this sterile mask on. And the reason is because this is a sterile technique. So in case you have the urge to cough or to sneeze, I want you to wear this mask to limit the risk for infection for your site. All right? I'm going to have you put this on. I'm going to have you turn your face away from the site. So it'll be your left. I'm just going to do it for you. All right, thank you so much. All right, so next thing I want to do, I want to do hand hygiene once again, 20 seconds, and then I'm going to put on a pair of clean gloves, and I'm going to remove the old dressing. All right, Mr. Navarro, is it okay if I take a look at your site? I'm just going to lower your gown just a little bit, just enough to see. All right, thank you so much. I'm going to remove the blanket as well. All right. So first initial assessment, just inspecting. I see that there's no redness, no swelling. I see that the tube is, the line is marked exactly as it was for the last procedure, which means it hasn't moved. And then I see that there's no cracks and leaks on the tube itself, on the line itself. So, all right, so I'm just gonna take it off. I'm gonna start on the edges over here. Make sure I stabilize the line so that it doesn't move. Okay, remove the old dressing. I think there's a piece of tape on here. I'm gonna remove that as well. Okay, there we go. All right. So now that I removed it, Mr. Navarro, are you feeling any pain or discomfort at all so far? No? Okay, any questions for me before I move on? All right, no, perfect. I'm gonna take off these gloves now to start the sterile part of the procedure. So hand hygiene once again, 20 seconds. Then I'm gonna start preparing to don my sterile gloves. So I'm gonna take this. Open it here, dispose of this. I'm gonna move this temporarily. Here we go. I have the sterile gloves on now. I'm going to dispose of this. I'm going to move this a little closer so it can work better. First thing I'm going to do, I'm going to clean the site. So I'm going to take gauze and I'm going to take the chlorhexidine wipe here. So I'm going to take the gauze, I'm going to hold the tube right here to avoid the site while I clean it. And I'm going to take the chlorhexidine, I'm going to crack it. Then I'm going to clean the surrounding area for 30 seconds. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. And then I'm gonna clean up the line 3 times. 1, 2, and 3. All right. I'm gonna let that dry, air dry for 30 seconds, and I'm gonna dispose of this chlorhexidine. Okay. Next, I'm going to put on the bio patch. First, for the bio patch, I'm going to hold it on the blue side. And then I'm going to apply it at the base of the line. Hold it like a taco and put it in right here. There you go. And then I'm going to take the Sorbaview and I'm going to apply it onto the site. I'm going to try to maintain a stress loop right here as I apply it. I'm gonna keep this piece just because it has the date and initial piece. Okay. All right, there we go. I'm gonna discard of this piece and discard of the gauze. I'm gonna press down right here. Okay. The first piece is on. I'm gonna put the other piece of the sword review on as well. Slide it under. Apply it just like that. Okay, discard of this. All right, and I'm gonna secure the tube as well with a piece of tape. With a piece of tape. Just to keep it away from your skin. All right, now that the sterile procedure is done, I'm gonna inspect it one more time. I don't see that there's any movement of the line. The measurement is still the same as it was documented. And I see no redness, no swelling. I don't see any cracks or leaks in the line, so that's great. So I'm just gonna remove my gloves. The sterile procedure is done. I'm gonna immediately do hand hygiene. 20 seconds, 20 seconds. Okay, I'm going to immediately date and initial this. So I'm gonna put my initials and date. All right, put it right there. Okay. All right, so that is, I have successfully put on the CVAD dressing. Did you feel any pain or any discomfort at all during the process? No? Okay, perfect. Any questions for me? I'm just gonna put on your gown so you don't get cold. Right? Put on your blanket as well. I'm gonna turn your head back. Go. I'm gonna dispose of your mask as well. Wasn't so bad, was it? Discard it right here. I'm gonna also discard everything that I have not used in the kit right here. Okay. Any questions for me before I leave? Nope. All right. I'm gonna make sure I document that everything was correct in the date, the time, the site assessment, and the measurement of the tube of the line, and then I'm going to also document the patient's reaction to the assessment as well. I'll do that later when I leave the room. And then I'm gonna lower the bed in the lowest position, put the side rails up, put the call bell right here. Do you have any more questions for me, Mr. Navarro, before I leave? Nope. All right. Thank you so much. I'll be back, or maybe another nurse will come and change your dressing in the next 7 days. Hand hygiene before I leave once again, and thank you so much, Mr. Navarro.